Well, this is a case of renal pathology. This is the left part of the left hemidiaphragm. This is the spleen, and this is the upper pole of the right kidney. Upper pole of the left kidney. This is a segment of part of the left hemidiaphragm. This is the spleen, and this is the left kidney. See, this is the capsule of the kidney. This is the calculus in the renal pelvis. This is a well-demarcated cystic area with internal echogenic areas in it. This is another well-demarcated thin-walled hypoechoic area seen relating to the upper pole of the right kidney, and this strap of that you are seeing is the iliopsoas muscle. This is the iliopsoas muscle. This is one pocket of loculated hypoechoic area with posterior wall plastic enhancement. This is the another one, which is at the upper pole of the left kidney with internal echogenic areas, and this is the calculus that is in the renal pelvis that measures approximately 16 millimeters or 1.6 centimeters. This is the renal capsule, and this is the upper pole. This is the mid region of the left kidney. This is the pelvis of the kidney. This is the iliopsoas muscle. This is the aorta. Now this is the view that it was in front of you. And there is another calculus seen. This is the parenchyma of the left kidney. This is the calculus in the lower pole calyces. Now the lower pole calyces are not dilated. This is the left kidney, the lower pole of the left kidney with the calculus in this region. This one. Let's have a relatively better view. This is the lower pole of the left kidney with a small calculus within it. This is the mid region. Now this cystic area with internal echoes in this cystic area that we were seeing initially as a calcification in it that gives posterior shadowing in the mid region of the left kidney. Now when I come across to the upper pole, I do see a well-demarcated echo-filled area moving with the kidney, sharing the capsule of the kidney. It shares the capsule of the kidney, glides over the iliopsoas muscle, and this is very much consistent with an abscess formation at the upper pole of the right kidney, which is sharing the capsule of the right kidney, of the left kidney. Now, in this case, there is one differential that we cannot rule out with ultrasound with certainty, and that is a possible adrenal abscess measuring approximately 4 by 3 centimeters. Now, This is the calcification in the lower pole calyces giving posterior shadow. And here is another complicated cystic area with internal calcifications below the capsule of the left kidney, subcapsular location. This is the area with irregular outer surface with these margins, internal echoes, as well as internal calcifications, along with a separate, well-demarcated hypoechoic area at the upper pole. This is the area at the upper pole of the left kidney, sharing the capsule of the kidney, moving with the kidney. So this is either a lobar nephronia or renal abscess or adrenal abscess, whereas there is no doubt about this area, this focal lesion that is cystic with echoes and internal calcification being an area of abscess within the focal. This is rather focal pyelonephritis. It's an area of focal pyelonephritis, and it's very complex. You see, this is the iliopsoas muscle, it glides over it. It moves with the kidney and glides over the iliopsoas muscle. So this can also be a region of focal pyelonephritis. Now these two lesions at the upper pole, this one and the other, this one, they do not communicate with each other. They are separate from one another. So this is a case of pyelonephritis, acute focal pyelonephritis with abscess formation or lobar nephronia, along with an echogenic area in the renal pelvic region, that is a calculus. So this is a complicated case relating to the left kidney of this patient. See this in magnification. And see the other area in magnification, which is either an abscess relating to this area I'm talking about, either an abscess relating to the adrenal gland, left adrenal gland, or again an abscess relating to the lower pole of upper pole of the left kidney, adjacent to which is seen an area, this area, it is thick wall with internal echoes and calcifications, is suggestive of focal pyelonephritis, lobar nephronia, or lobar nephronia. Now this focal lesion and this focal lesion, they share the capsule of the left kidney. This is the capsule of the left kidney. This is the splenic parenchyma. Thank you very much. Well, in this case, this is the hypoechoic area full of internal echoes, enhanced posterior wall acoustic shadows that was seen not communicating with a complicated cystic area and at the mid-region with internal echoes and calcification. Now here it can be seen communicating with the focal lesion in the upper mid-parenchymal region of the left kidney. So it does communicate, this focal lesion does communicate with the lesion adjacent to it. So this is a case of, so this rules out the possibility of an adrenal abscess. So adrenal abscess gone, this can, so these, the differential remaining are focal pyelonephritis with extension into the with extensions, and this is an extension from this focal lesion at the upper pole of the left kidney, and that's the reason it's sharing the capsule of the left kidney. Now we cannot rule out the possibility of Xanthogranulomatous pyelonephritis, as we did see a calculus in the renal pelvis. And you see the parenchyma in this region is almost thinned out. Only the capsule is seen, no parenchyma is visualized. Only the lower pole parenchyma was visualized. So this can be a case of acute pyelonephritis, focal pyelonephritis, Xanthogranulomatous pyelonephritis. So because this is I am giving the differential because I do not have any lab profile with me or any other imaging facility has been provided to me for the performance of this ultrasound. So when you are performing an ultrasound without lab or other investigative procedures, then you have to rely on your differentials and the findings that you see during the ultrasound. Thank you very much.